Hello, everyone, and welcome to another installment of our Career Chats videos. I am Joan Dixon, the Director of Student Programs at Gulf Coast South Area Health Education Center. And what you can see on our screen right now are the 6 youth programs that we offer at AHEC. They're all absolutely free of charge to students. We cover the Charlotte County, DeSoto County, Manatee, and Sarasota counties in Florida. We have health career presentation posted on our website. We have a full Career Chats video library, about 25 different videos you can look at this point. We offer health career camps in the summertime. I also work with HOSA Future Health Professionals clubs within the schools. If you're a part of a HOSA club and would like for me to come in and help you prepare for your regional, state, and international competitions, please give me a call or send me an email. We also have a REACH internship program to learn all about public health. And then once you get into college and you're in the graduate level programs, you can be a part of our 2-year AHEC Scholars Program, 2 years of intensive work to learn more about the public health fields. I am so thrilled that you are with us today. We have a wonderful guest speaker and a guest interviewer who I'm going to turn it over to right now. My intern, Emma, take it away.
Good morning, everybody. So our interview will be with Dr. Tanya Steed, who is a registered audiologist at Adept Audiology. So just as a brief description of what the job would be like as an audiologist. So an audiologist is a doctor who diagnoses, treats, and manages hearing, ear, or balance problems. They also determine the type of hearing loss a patient has and the severity of the condition to create the most effective plan for treatment. Some of an audiologist's duties include conducting hearing exams and fitting and monitoring patients' hearing aids. Audiologists can work with patients of all ages and are especially skilled in creative problem solving and medical technology. Welcome and good afternoon, Dr. Steed. Is there anything that you would like to add to that job description?
Thank you, Emma. Thank you for the interview. This is going to be fun. I would add that a lot of our patients don't need hearing aids. For example, since we see all ages, that means that we see newborns to see if they've been born with a hearing loss, and a majority of newborns have not, but we're catching them early. And we also see children who maybe have ear infections and are experiencing a temporary hearing loss. But that's about it. You did a great job with the description.
You. On the subject of that, what are a couple of specific ear infections you run into every day as an audiologist?
Every day, it depends on the age group you're working with. So some audiologists might not see anybody with ear infections if they're working with I'm so sorry about that. Looks like my internet cut out. So what I was saying was some audiologists might see children or adults with ear infections every day, and other audiologists, they might not see that, but once every couple of months. It just depends on the population that you're working with.
Gotcha. That's really cool to hear. So speaking of working environments, where do you work and what is the atmosphere like in your workplace?
I work at a private practice called Adept Audiology, and private practice audiology is specific to usually several audiologists, also working with maybe some hearing instrument specialists who primarily see patients who are wearing or need to wear amplification hearing aids to treat their hearing loss. And the atmosphere that I'm in is very positive because we have a work environment where all of the employees, from the person at the front desk who greets the patients and answers the phone calls, we are all committed to treating those patients like they're a member of the family. We want to remember them by name. We want to get to know them and their families and the different experiences that they have. And so the environment is very friendly, and our patients love to come into our office. It's not usually fun to go to a doctor's office, but we try to make it as enjoyable as possible.
Fantastic, especially since audiologists work with kids, and sometimes young kids can get a little scared when they go to the doctor's office. So that's so wonderful
Exactly.
that you keep the idea of family so close, especially in a doctor's office. So, what fellow health professionals do you work with in your career?
I started out as a pediatric audiologist. So I was actually up at All Children's Hospital, which is now Johns Hopkins. And in that type of an environment, you are in an outpatient setting, which means that you're not seeing patients who are in the hospital rooms. You are in a setting where patients are just coming in. Maybe they're coming in for speech therapy. So a child is having trouble learning how to produce certain speech sounds, or maybe they have Down syndrome, or they're on the autism spectrum and they need to have some support to help them with speech. So anytime a child's in speech therapy, they need to also have their hearing tested to make sure we've ruled out any hearing issues. So in that environment, I was able to work with speech therapists, occupational therapists, physical therapists. I was also on a team for a medical team that was for children who have a cleft lip and palate. And so that team had a developmental pediatrician, there was a surgeon, a speech therapist, a dentist, orthodontist, and we all worked together to collaborate on what the child needed. In more of an adult environment, you might work with social workers. So maybe the adult has a hearing loss that's so profound that it affects their ability to work. So you might work with a social worker or an occupational counselor to help make sure that they have all of the support that they need to be successful in their work environment. Maybe a telephone that's amplified, or a Bluetooth connection to their computer because they can't hear on a Zoom meeting, things like that. And then another area would be more of a medical aspect of being in audiology. So kind of like what I referred to earlier, if a child had frequent ear infections and they needed to have something called a tube put in their eardrum. Some audiologists just work with ear, nose, throat physicians. You also hear the term otolaryngologist. So an ENT, ear, nose, throat, is the same thing as an otolaryngologist. And the audiologist needs to be able to test the hearing of even an 6-month-old or a toddler. Imagine trying to put headphones on a 2-year-old. There's ways that we can test their hearing in a sound booth and tell the ear, nose, throat physician if they have hearing loss because they have fluid in their ear. And that would help the surgeon know if the child's meeting the criteria to have the surgery or not. It's pretty
Wow,
cool. We get to work with a lot of different fields.
that's crazy. So you have therapy, you have behavioral health, you have counseling, you
Mhm.
have different ENTs and even surgeons. Wow. So having this career as an audiologist allows you to not only work with several different ages of patients, but also with several different specialties of physicians and nurses.
That's right.
Wow. Wow. So on the subject of working with different health professionals, what kind of patients do you find that you work with the most in your career?
It really depends on what you're interested in. And I'll tell you that when I was in graduate school, I did not want to work with children. Anytime that the kids would come in and we were learning how to work with children and testing their hearing, I was kind of nervous. And so my first job, I just wanted to work with adults. I worked with an ENT, and if they needed surgery, we would do the hearing testing for that. Or if they needed hearing aids, we would fit the hearing aids. But within about a year in that job, I found myself looking forward to whenever the kids would come in. And so that's something that I learned within my first year, which was just because you think that you're interested in one area of really health or one type of population, you just don't know until you get more experience and you discover what you're interested in at the time. So I worked in pediatrics for about 13 years. And then around that time, within that time, I had children of my own. And I discovered that coming home to children and being at work with children was a little exhausting. So I moved into more of an adult setting. And even now, 20 years later, I'm in the private practice where I'm fitting hearing aids. 15 years ago, I said, I will never work in a hearing aid practice. And here I am working in a hearing aid practice because the technology changed, the reasons why I didn't want to do it, they was kind of changed. My life station changed, and I proved the saying, never say never, because you just don't know how your interests will change, and you can decide that in audiology. It's very easy to flow into different patient bases. For example, if you wanted to work at a veterans hospital, that's going to strictly be adults. And that's also outpatient. It's not, even though you work for a hospital, you're not seeing patients in hospital beds. You're seeing patients who are eligible for care through that agency. And that's a specific type of audiology. Those patients have all been exposed to hazardous noise from being in the military. Even if they were a cook in the Navy, they were exposed to hazardous noise when they were in boot camp. So you can choose. You can just choose your own adventure as you go in your career, what patient area you find the most interesting.
That's wonderful. And that's the whole reason why we do these career chats, to show students that they can keep their mind open when it comes to any kind of career. And that's why
That's right.
interviewing doctors like you is so important, because especially with your expertise with adults, with children, and also knowing that there are multiple different places you can work in, like a hospital, private practice, an outpatient center. It's so important for students to keep in mind that health doesn't just mean one thing, and that there's
That's
so
right.
many different things that you can explore, even within one career path. There can be so many
Mm-hmm.
different things you can specialize in. And that's why it's so great to have you here. Okay, so Dr. Seed, what is a typical day like?
Typically, the day will be filled with patients. Unless you're a business owner, if you own the private practice, maybe all of your activities are on the business side and managing employees and schedules. But typically, audiologists are boots on the ground. We are in a sound booth testing hearing, or we're in a programming room programming hearing aids, or we are programming. It's called mapping for cochlear implants. So it's 80% of audiology is direct patient care or patient counseling. And the other is managing schedule, writing your reports. You have to write notes or chart notes or reports on everyone. And you might be doing training to learn how to use a hearing aid manufacturer's software.
Well, that's great. So on subject of that, how many hours do you work per week or per day?
I work 4 days a week, 8 hours a day. Most audiology jobs are 9 to 5, so to speak. But you could be part-time or you could be full-time.
Are audiologists the kind of doctors that could be on call? For example, if there is an emergency at night where a child has an ear infection, or a child who has cochlear implants maybe has an issue with them where the battery's suddenly broken and they don't have extras.
Audiologists are not on call. That's a great part of audiology. You can leave audiology at the door when you leave your job. If you have an emergency like that, like the ones you described, if it's a medical emergency, they're going to see their primary care physician or their ENT. And if there's an equipment issue, the manufacturer who is responsible for the equipment, they have a hotline that patients can call.
That's great, especially in the case of an emergency. Okay, so what type of starting or median salary can a person expect if they're looking into audiology as their first medical job?
It ranges anywhere from 70,000 upwards of 110, 120,000 a year. It depends on your setting. If you're in a nonprofit setting like a children's hospital or a government agency like the VA, that's going to be different than if you are in a private practice that you own versus a private practice that you are a staff audiologist.
Mhm. That's a great difference to look into, especially if there are certain levels that a student may be interested in. So why did you decide to pursue audiology as your career?
My grandmother was completely deaf and she lost her hearing when she was in her 20s. So she did not learn sign language. She could speak, but I watched her navigate life and family communication without any hearing, without any hearing aids. She did it wonderfully, but there were a lot of opportunities that she missed out on. And I realized that I love helping people hear. Hearing is critical for relationships. Helen Keller, who you may know, was blind and deaf, and she was asked if she could pick between being blind or being deaf, which would it be? I'm glad that I don't have to make that choice, but she said she would rather be blind, which is, I think, maybe surprising. And it was because she said that being blind separated her from objects, from things, but being deaf separated her from people. And that's what I love about audiology and what drew me to it is that by helping people hear better, you're helping them in their family relationships, in their jobs, in communication, being able to communicate with a friend or family member. That is what, really makes people happy and have a good quality of life.
Fantastic. And especially thinking about all the families that you have helped in that manner is just so wonderful. So, what would you say is the most and least satisfying part of your career?
The most satisfying is what I just described. Just watching people be able to connect with their family members or hear things that they haven't heard in a long time. It's just so satisfying. The technology, especially for hearing aids now, it used to be the hearing aids they were pretty basic and they didn't help everyone. In fact, people watching this video might have grandparents or even great grandparents who have hearing aids that they leave in their top dresser drawer and they say that they don't help. And that's because they started wearing hearing aids at a time where the technology really wasn't as helpful as it is now. But now, and one of the reasons why I work in the hearing aid part of audiology is that the technology is fantastic with Bluetooth connectivity to your phone and ways that hearing aids suppress background noise, which is really difficult for people with hearing aids. That's very satisfying. I'd say the part that is the least is that hearing aids are very expensive because of the research and development that goes behind creating them and developing them. And also, the provider has to be paid to program the hearing aids and maintain those hearing aids for years. And so the hearing aid cost can be prohibitive to patients wearing them. Insurances, especially Medicare, so for patients who are 65 or older, and that's the majority of our hearing aid population, Medicare does not cover hearing aids yet. It's going to happen at some point. And in fact, I think this new generation of healthcare providers are going to be a part of making that happen. But a lot of times patients have to pay thousands of dollars for hearing aids that they cannot afford. And it's because the secondary insurance or the Medicare just isn't covering it. So that part is frustrating because I know that patients can receive benefit, but they just may not be able to afford it.
And that's also why hearing care and audiology is so important for patients to have. And yeah, but I'm really hoping that that helps out for them. So, in terms of your education, what did you need to get in terms of an academic standpoint to become an audiologist?
So I got a bachelor's degree in communication science and disorders. You can get a variety of degrees that are health or science related in your bachelor's. You would want to look at whatever doctoral program. So after you get your 4-year bachelor's degree, then there are 4-year audiology doctoral degrees. And so you would take 2 to 3 years of courses within that degree and internships. And then your 4th year is like a residency. So your 4th year, you go and you find a clinic who's willing to take you on and teach you about the day-to-day practice of audiology and whichever type of setting that you want. And by the end of that year, you'll be seeing your own patients and have a pretty good idea of what you want to do after you graduate. So it's the 4+4. It's a little bit like pharmacology, I think, and also optometry. So it's the type of doctorate that's a clinical doctorate, which is different than a medical doctorate. So an MD is going to go to medical school. An audiologist has a specific doctoral program where you just learn everything there is to know about audiology.
Well, that's fantastic and very interesting to hear about. So, which college or university did you specifically go to?
I went to the University of South Florida in Tampa.
Wow. Were there any hospitals or clinics in that area where you could do your clinicals, or did you have to go somewhere else for that?
Yes, so I lived in Sarasota at the time. I commuted quite a bit, but I worked at a VA that's right next to USF, the James Haley VA. I also did a traineeship at the Bay Pines VA in St. Pete. And All Children's had several satellites around the Bay Area that I was able to do training.
Well, that's fantastic that you were able to get some training and experience in lots of diverse locations. When you were at USF for your courses, what was the atmosphere like there?
If you once you decide in graduate school what you want to do, it doesn't matter what it is. I think psychology, optometry, whatever it is, once you get into grad school. So the time in your education where you're finished with your bachelor's, that environment is full of people who are interested in the same things that you are interested in, and they're focused, they're serious about their education. So it's very positive. You find that you're around people who are like-minded, excited about the, nerdy things that you're excited about. And so grad school, I think, is just really a fun time where you're learning about something that you wake up every day and you say, I can't wait to learn more about this. Not every class is like that, but most of them are. And honestly, that's how you know if you are in the field that you need to be in. Because if you are not excited about the classes that are in your grad school program, that's when you need to look for something else that makes you look forward to waking up every day.
Absolutely. And that's a great thing for all careers. and
That's
through
right.
education. So how did you end up paying for your education in university?
I was eligible for the Bright Futures Scholarship. I lived at home for a majority of my bachelor's degree I was responsible for all of my college. So in order to save money, I did not go and stay in a dorm. It was not an option for me. And I saved a lot of money that way. Thankfully to my parents who allowed me to stay at home during that time and help support me. And then in my grad school years, I did have to take on student loans, but I kept them. I worked really hard to keep those loans down as low as I could by not spending more money than I was getting from my loans. And also, I did the math of when I would be finished, how much that monthly payment was going to be, and I tried to always keep that in mind. So I kept my school loans as low as I possibly could by working part-time. And also, I applied to a traineeship that during my graduate school, it was actually a paid traineeship, which was really nice. And so I looked for opportunities to make a little money and not spend too much money.
And that's a great thing to keep in mind too, to put yourself in a great position for grad school and to save as much money as you can. So speaking of that traineeship, was there any interesting case that you worked on during your residency or any specific case you've come across in your working life that was especially important to you?
I would say having a couple decades under my belt now, it would be that when in my first job at All Children's, I mentioned that newborns can be tested for hearing loss. And at that job, we would be the first person to confirm if the newborn had hearing loss. So I might see that newborn at 4 weeks of age, and through testing over the next couple of months, identify that they have a hearing loss, and the timeline to fit a newborn is in within the first 3 to 6 months. So I had the opportunity to fit a good amount of itty bitty babies with hearing aids and watch them either get a cochlear implant or wear hearing aids, get into speech therapy, start kindergarten, and watch that progression to the point that about a month ago, I was working in my job where I primarily see adults, and a young man came in and he had found my name on the internet, and he came in to thank me. He took the time to thank me. He's in his 20s, and he said, "You fit me when I was this age." And he was working and enjoying his life and wearing hearing aids. And that is something that you just can't put a price on, to know that every time in healthcare, the great thing is that you always meet people. And every person, you want to think, I want to do what I can to make their life better. But to have that one person come back 20 years later, and it was just a day at work for me, but it was life changing that I had the privilege of being in his story. I would say that's a big one. That's a big one that stands out.
That's so sweet. And I imagine that that made your day when he came in.
It
That's
did.
that's insane to think 20
It
years ago we
did.
worked in a little newborn baby and here he is, 20 years old, coming into your office. That's so wonderful. Okay, so to sort of wrap everything up, what would you say was your best piece of advice to give to students either looking into audiology or having an interest in audiology?
I would say shadowing. Go find an audiologist who, even if it seems like it's not the part of audiology you're interested in, just start meeting audiologists and see if you can spend a day with them or half a day with them. because they'll know an audiologist and that audiologist will know another one. And if you spend the time, you will know this is something I'm really interested in, or you'll say, oh, that wasn't exactly what I thought it was going to be. And I say that because originally I thought I wanted to be a deaf education teacher. And I went to a classroom and immediately realized, actually, this is not what I want to do at all. And so I had to regroup. It took me a while to stumble upon audiology. And that's when I observed that job, I knew, oh, okay, I was interested in hearing loss, but really what excites me is this, not deaf education.
Well, that's so great. And thank you so much for joining us, Dr. Steed, and answering all of my questions. It was so exciting to hear about your journey as an audiologist. And I believe that this interview will give students a better understanding of what audiology is all about.
Thank
So
you, Emma.
of course. And thank you so much again for joining. So as a quick little reminder, if any students watching are interested in interviewing a family member who is a healthcare professional or a healthcare professional who has made an impact on your life, you can reach out to Miss Joan Dixon or find interest in any of our student programs. So the one that I'm specifically in is the REACH intern program, but you can also find a connection through the health careers camps that take place at 3 different hospitals every summer. All right. Well, thank you everyone for joining us. Thank you again, Dr. Steed, for being here today and answering my questions. And I hope you have a wonderful day.
You too. Thank you, Emma.